The coronavirus outbreak and fears of it spreading are also a concern right here at home. While there are no confirmed cases in Canada, some health officials say it's just a matter of time.
Good evening and thank you for joining us. We begin with breaking news in Ontario. The province's chief medical officer is investigating a case that may be linked to the new coronavirus. Global News has confirmed the presumptive case is at Sunnybrook Hospital in Toronto. Health officials have yet to confirm the case because they have to wait for samples to be tested at the National Lab in Winnipeg.
Let's talk to an expert who was listening in on that press conference with us. Dr. Susie Hota from Toronto, a leading expert on these infectious types of diseases, has been with us for the past couple of hours, and we appreciate you sticking around so much because, of course, major breaking news in this country. But again, to not sound alarmist, this person is alive and they're being taken care of in a hospital. But immediately we're getting the sense from folks, and you're seeing reaction on social media, you're seeing reaction from people emailing, asking questions. How worried do I need to be? So a patient comes into your office and says, look, I'm from the town that this guy lives in, and I was just at the airport as well, or I might have ridden on a bus that he might have been on. How worried do I need to be?
So again, I think information will continue to develop as we get more information, I guess, data from what's happening in Wuhan. But let's just keep this in perspective. This is not something that so far we've seen is transmitting very, very easily from person to person. So, you
have to be very close, they said.
Exactly.
Okay.
Close enough. So, these are viruses that tend to travel in large droplets that are generated when you cough or sneeze, and if you're infected with the virus, and especially when you're really sick from the virus. And so those large droplets really don't travel very far. They go maybe 2 meters away. So if you're just sharing a room with somebody who may have this infection, your risk is still, it's low. It's that kind of contact that you need in order to get infected.
Okay.
Our Mike Drolet is following the latest developments with the case in Toronto. Mike, health officials still have to confirm if it's an actual case, but what signs seem to be pointing to this new virus?
Well, Robin, a few things line up. Number one, the man traveled from Wuhan, which is at the epicenter of this crisis. And scientists have already mapped this virus and developed a test to be able to determine who has it. Now they're confident enough with this man that they are trying to retrace his steps and get into contact with anybody he may have come into contact with.
Health officials said it was inevitable that Canada would have a confirmed coronavirus case soon. Well, late Saturday afternoon, it was announced that a man in his 50s had flown out of Wuhan on the 21st, arrived in Toronto on the 22nd, and was in Sunnybrook Hospital with symptoms on the 23rd, where he remains in stable condition.
The patient was detected and immediately put in isolation. Lab tests were conducted, and at the earliest signs of a presumptive positive case, Toronto Public Health launched extensive case and contact management to prevent and control further spread of the infection.
Those who are in closest proximity to him have put themselves in self-isolation as a precaution. It speaks to how quickly the virus is spreading around the world and why China is scrambling to get it under control. A 1,000-bed hospital is being built in 6 days, with another on its way.
加油，武汉！
In an upbeat and flashy show of strength, Chinese news anchors urge those affected to strive on. However, the streets tell a different story. They should be filled as China celebrates the new year, but tourist attractions like the Forbidden City, Great Wall, and Shanghai Disney were closed.
In response to the prevention and control of the disease outbreak.
It's that mixed message that has residents in Asia concerned about what is and what isn't true.
We've seen some ambiguous reports coming out of the mainland.
What is certain is that China has taken some unheard of steps to control the disease, with a lockdown affecting 48 million people and a travel ban covering 15 cities in Hubei province.
We've never seen a travel ban like this before, so it's not clear how effective or ineffective this will be.
So far, the World Health Organization has decided against declaring the outbreak a global emergency. Yet it's clear the virus is spreading, with cases in several Asian countries, as well as Australia, the US, and France, where masks are now in short supply. And while Canada can be added to that list, officials say the world is better prepared this time. Already, scientists believe they've traced the origins of the virus to a seafood market in Wuhan, which also sells live animals. And while the incubation period makes it difficult to screen potential carriers at airports, an accurate test has already been developed to determine if a sick patient has been exposed.
We have the full genetic makeup of the virus that's causing the disease. Public Health Ontario have been able to develop a rapid, accurate diagnostic test.
Mike, we've talked about how inevitable it was that Canada would be hit with this virus. What is the risk to Canadians at this point?
Well, officials maintain that the risk is low, even though that this virus is more contagious yet less deadly than SARS. The man in question wasn't in Toronto long enough, very long at all, before he started showing symptoms. He then was taken to hospital where he was put into isolation, and everybody he came into contact with within his own household have put themselves in self-isolation. But considering what is happening in China, officials are trying to be positive, yet they are certainly not taking anything for granted. Robin?
Mike Drolet in Toronto.
So let me play devil's advocate in this situation where the worst scenario might be that the person sitting next to this man in his 50s who is traveling back from Wuhan, he's sitting next to someone, the patient coughs, that's very close. And let's say whatever virus he was carrying gets transmitted into that individual. We don't know about this person now. And let's say that person took public transit home and has been in contact with a number of people in his or her office and his or her family. Right. How do medical officials in this country go about figuring out where all those people are?
Yeah. So, I mean, the people who are in closest contact with this individual are the first sort of ring of individuals that they will be looking for and giving advice to and monitoring. So, public health right now is very busy reaching out to these close contacts, household contacts, people who would be on the same row as that individual on the plane, as well as, up to 3 rows away from that individual because of what I mentioned in terms of how far these droplets could actually go. So, really prioritizing the highest risk individuals. And the first thing you're going to want to tell them about is educate them on this whole issue and the illness. So what symptoms to look out for? The early symptoms can be fever, it can be cough, or just, sort of respiratory infection symptoms that you would normally get like you would for a common cold or a flu. Or some people will get shortness of breath. So making them understand what to look out for and understand what they need to do if they do develop symptoms. It's not going to be your usual how you manage your cold. This is something that would be very serious and would have to be reported to public health, and any healthcare facility that this person would go to would have to be aware of that in advance. So those are the pieces of advice and the kind of monitoring that would be happening.
Okay, to that point, I should note that the Deputy Premier, Christine Elliott, did mention that the province has set up a website that is specific to this type of coronavirus. Let me just pull it up for you. I have tweeted it, folks, if you're looking for that information, at Natasha Fatha, and you can find it there. But this is ontario.ca, and it's a page specifically for Wuhan novel coronavirus 2019. And it goes through a series of things of how to protect yourself, what to do if you're feeling sick after travel, what are possible areas of lab testing, how the province is preparing. So there's lots of important information there if you're looking for that. So certainly information constantly being updated and being made available. But about that press conference, I wondered what you interpreted by the fact that it was so well organized. What is the statement, do you think, these health officials are trying to make by having 6 or 7 of them sitting together? It's well organized. Why not just put out a press release and say, hey, it's confirmed, we're watching it?
Oh, I think we've learned a lot from the past. First of all, addressing these issues before rumors start to go and head on. And that's exactly what they were trying to do here. Some people were questioning, why are you coming forward when it's a presumptive test positive? What does that even mean? And I think the answer that was given was really an excellent one, where you can see the advantage of having these additional days to actually move forward with getting people aware of what happened and following up. So that was one message. The other message was we're all working together. So various levels of government, public health, the physicians, the hospitals, everyone was there together. And it was a unified message that they were giving. And to me, it was a message of this the system worked. It all played out the way that we expected it would have, being prepared to deal with this kind of situation.
Okay, that's a really interesting way of looking at it. The system is working. Yes, a person got sick, right, but the protocols were followed that are necessary.
celebrations and well wishes for a joyous Lunar New Year. Everywhere but China. The country's biggest holiday began in the shadow of a deadly new virus that's spreading around the world. Usually a time for reuniting with family and sharing a meal. But this year, residents in Wuhan, where the outbreak began, line up at hospitals to be tested for the dangerous coronavirus or worry about sick family members.
At this time of year, it may be difficult to distinguish the symptoms of novel coronavirus from other respiratory viruses that are circulating, like influenza. We're asking travelers returning from Wuhan to be on the lookout for fever and respiratory symptoms like a cough.
Desperate to contain the disease, Chinese authorities locking down millions, canceling planes, trains, and now banning most vehicle use in downtown Wuhan.
提升到最高級別嘅緊急 emergency.
In Hong Kong, the city's leader declaring a state of emergency. The vast majority of cases and the dozens of people killed have been in China. But the virus has been detected in more than 10 other countries, almost all involving people who traveled from China. International travelers are expressing mixed levels of concern.
When everything started shutting down, we thought we should leave. When you see no people on the street, it was worrisome.
Everyone on our flight pretty much had masks.
When you go out from Beijing airport, they take your temperature. If you got fever, there is a control there. But
were you scanned when you came into this country?
Yeah, we were scanned.
Airports are stepping up screenings for suspected cases of coronavirus, but some experts say they provide false comfort.
During the SARS outbreak, it was not very effective. During past flu outbreaks, pandemic flu, it has not been necessarily very effective. It is an opportunity to provide information to people. The most important measure for surveillance for new cases that we have will be having healthcare workers who are trained to know the symptoms, know what to look out for.
China's leader has called the accelerating spread of the coronavirus a grave situation. For City News, I'm Karen Seolin.
Dr. Alain Weisman is an infectious disease specialist with the University Health Network, and he joins us now to talk about how hospitals are dealing with this situation and preparing for the possibility of an outbreak. Dr. Weisman, thank you for making time for us. I actually want to begin with the latest breaking news that we're hearing out of China, that now it's 41 confirmed deaths linked to the coronavirus. That is a jump of 15 individuals in a single day. And put in another way, it's a jump of 60% in a single day in terms of deaths. When you hear those numbers, what goes through your mind?
I think a lot of health agencies here in Canada, across the world, are looking at those numbers. On the one hand, it is quite shocking and quite a dramatic rise. On the other hand, I think a lot of agencies, including our hospitals here, are preparing themselves and have already prepared themselves for this, what seemed to be an inevitability of the rise in these numbers. So on one hand, it is quite a dramatic rise, but I think many places around the world, including our hospitals, have prepared themselves well for this possibility, for this rapid rise in the mortality and the number of cases we're seeing.
Okay, so you're on the front lines. What I'd love to do is go through a step-by-step process of how exactly this could take place in Canada, because we keep hearing again and again, it's just a matter of time that it's going to make its way here. So let's begin with the testing process. If someone is demonstrating symptoms, if a doctor feels that this person needs to be separated, they need to be tested, how does that process work?
Well, firstly, when patients come into our emergency department, for example, here at University Health Network or many other hospitals across Canada, we ask a set of screening questions related to the symptoms and also a compatible travel history where we'd be worried that they are actually exposed to the virus. If they screen positive, we immediately isolate them in the appropriate precautions and in their own room with special features in that room to make sure that the virus isn't spreading. And then we will initiate rapid testing of that virus, which means taking appropriate samples from the respiratory tract and sending it off for testing. And here in Toronto, for example, we'll be sending it off to Public Health Ontario, where they've already prepared to do this and to do it rapidly to test for the virus that's been identified.
Okay, so then let's imagine a scenario where one individual here in the city of Toronto, let's say at your hospital, does get confirmed with the coronavirus. They get separated from the group, you put them in the special room to make sure that they are isolated, but then what happens and how does the public become informed of what's going to happen next?
So I think we take a look at two aspects of the management of that patient. One is what we're doing for the patient in the hospital. So in terms of treatment for this virus, there are unfortunately no specific therapies, so we'd continue supportive treatment and monitor the patient closely, keep them on precautions, and provide the appropriate care like we would for any other patient. So have all the usual healthcare workers see that patient. And usually when in this setting, because of the heightened awareness, that will be reported up through Public Health Ontario and to the Ministry of Health here. And that information will invariably be made public be made available to the public thereafter. The other aspect is what would we do? What's the management outside the hospital? In other words, what do we look at in terms of the patients before they came? And what I mean by that is making sure that we track whatever exposures a patient had prior to coming to the hospital to make sure there was no additional patients who might be affected or who were exposed directly from the index patient. And that's the responsibility of the public health agencies here in Toronto and also across Canada. Local health agencies would do that step as well.
Okay, so continuing on with the scenario, let's say it's more than one person. Let's say multiple people in a few different cities are now confirmed with the coronavirus. Then what happens?
Well, we would definitely take the same approach as with each patient that we see. So we would do what's called contact tracing. So we try to figure out where the patients could have acquired the virus and do our best to try to contain that. And that, again, is the role of the public health agencies across Canada. Within the hospitals, again, it's a similar kind of treatment. We would support the patient, make sure they remain on isolation, and make sure that there's no breaches in the isolation within the hospital. So we would make sure that everything is done appropriately, healthcare workers and other patients have not been exposed, and if the system that we've put in place has been done correctly, that would be very unlikely. If we see it in multiple cities and multiple locations, then a very intensive investigations will be conducted to figure out where it could have come from, what the source might have been.
Dr. Baseman, how close are we to getting a vaccine for this coronavirus?
As far as we know, this would be quite a long ways away. This would be in the range of several weeks to months, if that's even possible. We don't know what the status of the outbreak will be at that time and whether the vaccine will be available, how effective it will be, and whether or not it'll be deployed very easily to the places that are most affected by this virus. So, for example, the areas around Wuhan and China. So we're not really expecting the vaccine to be available in any time soon so that it might help contain this virus in the next few weeks or maybe even months. In the other outbreaks we've had with coronavirus, with SARS and MERS, we haven't seen a vaccine that's been effectively deployed or created during the time of the outbreak.
Now, a lot of the story is also the emotional reaction, the fear factor for so many people. So I want to break that down into two parts, which is how do you make sure that the public responds in a logical way and not one based on fear?
I think having the various professionals and experts come onto the various media sources and discussing this is one way to alleviate those concerns. I think it's important for Canadians to realize right now that there hasn't been a single confirmed case in Canada yet. And the likelihood of there being an outbreak like we saw previously in SARS, for example, is far lower now due to the infrastructure we have in place, things that we didn't have in 2003. So I think that's a very important message that needs to be sent out from all the various health teams across Canada, that what we have in place now has a very good chance of preventing outbreaks occurring in Canada. And so we will hopefully continue to do that and make sure people are aware that this is not something they need to specifically change their behavior for on a day-to-day basis, and that we're informing them on a day-to-day basis as well about what's happening with the virus across the world.
Okay, Doc, now let's get personal because you're working in a hospital. We've introduced you as being someone who's on the front lines. You're working with other people on the front lines. You're working with nurses who would be greeting people, folks in emergency rooms. People are coming in, they're coughing, maybe they have coronavirus, maybe they don't. How are individuals in the hospitals reacting? Are they nervous about this?
Certainly there's a lot of concern from the healthcare workers at our hospital. Certainly a lot of their experiences colored by the experiences of SARS. But the nursing staff and the frontline healthcare workers across the board have been extremely accommodating, extremely understanding. They are open, of course, to do whatever needs to be done. They are extremely cooperative. There has been no concerns from that point of view, despite the fact that this is a significant challenge to their day-to-day work, and despite the fact that this does pose a risk, despite how minimal it could be to them. But they have been excellent, and we've been provided with excellent support as well from the leadership at our hospital. And this has been true from across the board in various hospitals in Toronto in terms of the support from frontline staff who have been excellent. On top of that, the leadership in the hospitals to recognize this problem and to support us very early on.
What do you think about the World Health Organization deciding yesterday to not declare this a global health emergency?
Although it wasn't declared an emergency, it doesn't necessarily change our approach across the world and how every hospital is managing this. Their approach is based on the likelihood of this virus having transmission events outside of China. So it's really based on that concept, is what's going on outside of China in terms of transmissions. And because there hasn't been any transmission events outside, that's the primary basis for them not declaring it a world emergency across the globe. But no matter what they decide with regards to that decision, we here and at other places are still continuing our heightened surveillance and education of the healthcare workers, education of the public, to make sure that this doesn't develop into a worse problem.
Okay, Dr. Vaisman, thank you so much for your time and for your insights.
Thank you very much.
Dr. Alon Vaisman is an infectious disease specialist with the University Health Network right here in Toronto.
We have the first presumptive case confirmed of this novel coronavirus here in our city.
The case is in a male who's in his 50s. He had traveled to Wuhan, China, and come back, and within a day became quite ill. And the emergency service was aware of his travel history, used full precautions, was taken to Sunnybrook Hospital, and is now in a negative pressure room. All the staff are taking appropriate precautions, and the condition is stable.
Can you tell us what city they came from? I mean, it seems odd that you wouldn't be able to tell us much. It seems like you're actually holding back information. I know it's all new to you as well, but we're talking about a flight with hundreds of people arriving in Toronto with a virus that is killing people. You understand why people will be apprehensive.
What we do know is he took a flight from Wuhan to Wanzhou, Wanzhou to Toronto. The details are still forthcoming.
And so what is your message to the public at this stage in terms of, being aware of symptoms? How do people know whether they have come into contact with this?
We would certainly encourage people to check the website that has just been established, ontario.ca/coronavirus. That will contain information about the symptoms that may be indicative of the coronavirus. We encourage people to come forward. This person in question self-identified and came forward. And we also encourage people to take normal precautions, making sure you wash your hands often, coughing into your elbow, just all the normal things that you should do to prevent transmission of any kind of virus.